Assalamu alaikum. Hi viewers. Welcome to my channel Home Remedies Doctor. In this channel today we are going to talk about the toothache and the gum remedies for the immediate relief. My recommendation before we start our home remedies is that here I am going to present 5 different home remedies for the toothache and the gum infection. So please go through all of them in this video to the end. The procedure of using the ingredient for toothache and gum treatment is practically done with almost 100% satisfactory results. Most of the elements used are safe and easily available in almost all kitchens and homes. No remedy for the toothache is perfect replacement of a dentist. However, some of them can give you relief from few days to several months. Home remedies are most helpful when dentist doctors are not easily accessible. Some of these home herbal remedies provide a permanent cure, but most remedies are for the temporary relief only. The number one is salt. Salt is very effective in all treatment of toothache and gums. Take 3 teaspoons of salt and half glass of water, mix them well. Now rinse salt in your mouth for full 1 minute, 3 times total 3 minutes. Do not eat or drink anything for next at least 20 minutes. Repeat the process 3 times a day, 8 hours apart in case of no alleviation of the pain in first 8 hours. Do not repeat more than 3 times in 24 hours. It is also recommended that the person having constant teeth and gum problems must rinse mouth with salt for 3 minutes once a week in normal situation. Next is ginger. Ginger is another very effective treatment, especially in case of sore gums or in case of gum infection. Cut a small piece of ginger or half teaspoon of ginger extract. Place a piece of ginger on the sore. In case of using extract, drop juice right on the top of the affected area and try to keep there for around 10 minutes. Remove the ginger from the affected area and rinse your mouth. Do not swallow. Repeat the process 2 times a day, 12 hours apart in case no elevation of the pain or lessening of the gum infection in first 12 hours. Continue this treatment for next 3 to 4 days, especially for the effective treatment of sore gums. It is also recommended that person having constant teeth and gums problem must rinse mouth with ginger once a week in normal situation with no gum sore. Then next is clove. Clove is another very effective home available remedy for toothache and gums infections, used for very ancient times. Take 2 drops of clove oil or 6 pieces of clove complete with head. Drop or place clove on tooth gum causing pain and close the mouth. If the tooth has cavity, it is best to have clove oil instead of clove. Keep clove oil or clove in the mouth for 10 minutes and swallow. The clove remains. Do not rinse your mouth and do not eat drink anything for another 15 minutes. Repeat the process 2 times a day, 12 hours apart in case no alleviation of the pain in first 12 hours. This process 1 time before sleeping in the night is recommended. It is also recommended that person having constant teeth gum problem must rinse mouth with clove once a week in normal situation. Next is alum. Alum is another very effective home available salt-based compound can be used in the treatment of toothache and the gums. Take 10-gram piece of alum, a small piece equivalent to the 1 teaspoon is enough in half glass of water. Leave the alum in water for 15 minutes. Stir the alum in water with a spoon for a minute. Take out the alum from the water and keep safely at a side. Now rinse alum in your mouth for full 3 minutes, 3 times. Do not swallow. Do not eat or drink anything for next at least 20 minutes. Repeat the process 2 times a day, 12 hours apart in case no alleviation of the pain in the first 12 hours. This process 1 time before sleeping in the night is recommended. It is also recommended that a person having constant teeth and gums problem must rinse mouth with alum for 3 minutes once a week in normal situation. Next is hydrogen peroxide. Hydrogen peroxide is another very effective home available remedy but needs some cautions to use. Take 1 teaspoon of 3% hydrogen peroxide and half glass of water separately. Rinse mouth with 3% hydrogen peroxide for 20 seconds. Then immediately rinse with the water 3 times. Do not swallow. Do not eat or drink anything for next at least 20 minutes. Make sure that you do not swallow is a very important point, that we must not swallow the hydrogen peroxide Once in the mouth, it should be spit out completely. And with the water, we will make 3 times, so it will rinse the mouth with the water with 3 times. So the next is, do not eat or drink anything for next at least 20 minutes. Repeat the process 2 times a day, 12 hours apart, in case no alleviation of the pain in 12 hours. This process 1 time before sleeping in the night is recommended. This procedure only when the tooth and gum infection creating pain. Otherwise, you don't need to do this treatment in normal circumstances, as it is good. As the hydrogen peroxide is very effective in killing the bacteria, you can say, or the infection. And but in fact, it is only good that we will use when we have some problem. So that's all for today. So if to summarize, then I would say, like, we can go through the 5 basic things that we have discussed here. That is, 1 is salt, other is ginger, 3rd is clove, 4th is alum, and 5th is hydrogen peroxide. These all 5, one of them will be tried one at a time, and then I believe that at least one of them will be very effective for the tooth and the gums treatment. Thank you for watching this channel, and have a good day. Bye for now.